Have you ever tried quitting smoking and failed? Do you know anyone else who tried quitting smoking and failed? Well, I hear this a lot from all of my patients. So in this video, we're going to talk about why it's so difficult to quit smoking and what can we do in order to successfully quit smoking, like not go back to cigarettes again ever. All right, so let's begin with why quit smoking, right? We all know why, so let's not dive too much into it. We'll briefly mention some of the facts that we already know, that nicotine is highly addictive. There are about 6,000 chemicals found in cigarettes, and about 69, 70 of the chemicals are known to be carcinogen, which means they cause cancer, and not just lung cancer, but basically cancer anywhere in the body. And it also causes COPD, which stands for chronic obstructive pulmonary disease. It's sort of kind of a asthma where a person have hard time breathing. They can inhale in, but they can't breathe the air out. And oftentimes this disease progresses pretty fast if you continue to smoke, and then eventually end up on oxygen, and then you do get a feeling of suffocation closer to death. So last thing, smoking does kill brain cells, so your cognitive function do decline because of smoking. Now, quitting methods, there are so many different quitting methods that are out there, and I think number one that ranks is getting a heart attack. I don't know who wants that, but oftentimes after having their first heart attack, there's a high success rate of quitting smoking, probably not the best route to go to. Then there are a lot of other options such as hypnosis, acupuncture, behavioral therapy, motivational therapy, medications, which usually we're expert at. But however, I think not individual therapy itself can help except getting heart attack. Why is it difficult to quit? Basically, we need to know that there are three parts to it that makes it very challenging to quit smoking. Number one is dependency. Nicotine is highly dependency, so the body depends on it, so basically it craves for nicotine, which is why a person wants to go back and smoke. And second part that plays is psychological. This smoking cigarette or act of smoking cigarette does help reduce stress, which is absolutely true, although nicotine does cause some anxiety, but the psychological component of it is much bigger. And then third component that a person remains addictive to it, smoking, and has a challenge of quitting smoking is muscle memory. Habitual. It becomes a habit of after years of smoking, decades and decades of smoking. Basically, you develop the habit and a muscle memory, and that's hard to break. Although you're taking care of the one of the other two factors. So basically, what we need to do in order to successfully quit smoking, we have to tackle all these three parts at one time. First, understand them well. Second, recognize them, and third, tackle them to succeed. So let's dive in. Number one, nicotine dependency. We can target it two different ways. One of them that many people know is through nicotine replacement therapy, which is usually nicotine in some kind of different form. Either it's patches, gum, an inhaler spray, and they do work for short period of time, but not for long period of time, because remember the other two factors are not being addressed. And then second thing, if we're not using nicotine as replacement therapy, then we could use medications to reduce the craving, and sometimes a combination can be used. A medical doctor will help you manage and pick which ones for you. And remember, it's a trial and error. There is no one medication superior than the other. It's all about how you tolerate the medication. Number two, which may not come from a physician and you have to act on it on your own, is psychological dependency. And let's pick a scenario. This person A is a heavy smoker at work, doesn't matter what kind of work. Now a stressful situation is falling, and they're becoming stressed to a point they need a break. Or do they say, I'm going to go ahead and have a smoke break or cigarette break or whatever? And then they step out, smoke, which takes about 5 to 7 minutes. They're by themselves, they're lonely, so this is where I call cigarette as your best friend. So you're spending those 5 to 7 minutes with the cigarettes alone, away from the situation that caused a lot of stress. So this becomes a very relaxing scenario. So basically you're de-stressed here. Now, if you could recognize this situation, you can get away from that stressful situation on your own, sort of kind of smoke break, but you're not gonna smoke. Rather, what are you gonna do? You're gonna find somewhere that's alone, away from that place, and do something. Maybe take 10 deep breaths. Maybe do some meditation, do some yoga, or talk to somebody else that's non-related to the stuff that was stressing you. That's the second component. At the same time, we need to add a third component to it. And third component is habitual muscle memory, right? Which means what? That's your habit. Even though you have a nicotine patch or a medication and you got away and you're doing meditation, you still prone to smoke. Why? Because you have that habit, habit of hands going, reaching the pocket, taking the cigarette out, put it in your lip, lighting it up. All those muscle memories are coming to play and forcing you subconsciously to smoke, right? And you have to recognize that. This is where carrots come handy. So basically, I tell everybody, carry baby carrots with you, and as you carry them, and every time you have that, rather than smoking a cigarette, you eat that carrot. So now look at this scenario now. What you're doing is you're tackling these three things by one, nicotine replacement or medication. You're getting away from stressful situation and doing something to de-stress yourself, such as meditation, yoga, deep breath. And third, you're still doing act of what your muscles are used to, and that is done by chewing on something. And the reason I say carrot is a healthy alternative to then junk food, which oftentimes people would say that as I was quitting, I started to gain weight, and then they started to smoking again. That's how the gaining weight is related. So rather than eating junk food, you'll be eating carrots or any other choice of vegetable that you like. Now, the key thing is to recognize all these three things, and some of the challenges that you're going to face during this process is a key thing, because that's going to be something that's going to turn you away from quitting. But once you recognize it and you understand it and you find alternative to it, they will help you. So, number one, nicotine craving. Next, irritability, frustration, and anger. Anxiety or nervousness, difficulty concentrating, restlessness, insomnia, fatigue, headache, tremors, increased appetite, leads to weight gain, and depression. So these will be challenges. As you recognize these things, make sure you address them appropriately. And how long does it take to quit smoking is a key thing to understand, because oftentimes people want rewards overnight, meaning by I'm going to go cold turkey, I'm done. It's not going to happen. Most of the people who are smoking for decades, right? So which means I always tell everybody, go back to how you started smoking. It started with a cigarette here and a cigarette there and a cigarette there. You didn't go to 1 pack or 2 packs a day. So now understanding the concept of how you slowly started, you're also slowly breaking. Now we're going to go back to something I always talk about, willpower and habits, right? So you have a willpower to quit smoking. These habits are a challenge because first you're breaking some habits, second you're building new habits. So be patient and work with it. It may take 6 months, it may take a year. Some people it may take 2 years, and for others it may take 3 years. Nevertheless, don't give up and continue the process. Let's say after 2 weeks or sometimes 4 weeks, you took a cigarette and you smoked, or you took 2, 3 before you realized that you went back smoking. That's okay. Just start again. That's just a normal process. Restart and stand up again and just carry on until you quit, my friend. You quit smoking. Okay. So that answers how long it takes. A brief story, personal story. My own father smoked cigarette for decades. To at one point he was smoking 2 packs a day, and probably have 50 years of a smoking history and multiple attempts to quit smoking in the past, going cold turkey, this and this, and there were so many excuses and challenges that kept coming. But at that time I really didn't understand the 3 components of this thing, so we kept trying different medications and this and that, and sort of kind of all methods failed. When I applied these 3 things with him and continued working, he became smoke free, and now he's smoke free for about maybe 2.5 years or so. So that story basically inspired me, and I've talked to so many other patients about this, and results are good. So I want you to try it. Write it in comments what you think, what are your challenges, how are you getting over, so we could help the community to become smoke free, or I should say tobacco free. Before we quit, last thing to remember here is those electronic cigarettes are not alternative to quitting smoking. They have their own set of challenges that we're learning, right? So whole detail for another day, but just keep in mind, don't use that as an alternative. See you.
I hope you find this video helpful. Please like, comment, share, and subscribe. Thank you for watching.